Hey everybody, Dr. Michael Nusbaum here on Health Talks. I want to talk to you about the fact that your weight gain may not be your fault. It could be a hormonal or metabolic problem. What do I mean by that? Well, it's really important to find out what your basal metabolic rate is. Why? That's the idle, the engine of your body, and it's affected by many things. If you have hypothyroidism, your thyroid isn't functioning normally, you may have Hashimoto's thyroiditis, you may just have idiopathic hypothyroidism, which means we don't really know why you have hypothyroidism. You could have a hormonal problem. Estrogen, progesterone, testosterone in women, testosterone in men. If those levels are off, more than likely your basal metabolic rate is going to be slower than it should be. And the weight gain, it's not your fault. So let's talk about that a second. So let's talk about a typical 50-year-old woman. Maybe she's peri or postmenopausal. Her basal metabolic rate should be around 1,800 calories. I've seen patients who've had basal metabolic rates at 1,200 calories. So if you should be burning 1,800 calories, you're only actually burning 1,200 calories, but you're taking in 1,800 calories, 600 calories every single day is going to fat. Well, that's a lot of weight. That's 2 or 3 pounds every month creeping up on you. And that could be why you're gaining the weight. Now, in men, I've seen, let's take a typical 45-year-old male, 6 foot, his basal metabolic rate is probably around 2,500 calories. I've seen men who've been 1,500 calories. So if you look at the difference between taking in 2,500 calories and burning 1,500 calories, 1,000 calories every single day is going to fat. Well, that's a lot more weight. That could be as much as 5 pounds every month creeping up. So knowing your basal metabolic rate is really important because that's going to tell us whether the weight gain is not your fault. So what can cause it? As I said, if your hormones are off, so if your thyroid is not functioning normally, or if you have estrogen, progesterone, testosterone levels that are off, those can cause your metabolism to slow down. In that case, you are going to be putting on weight, even eating a normal amount of food or what you think is normal for you. So if your metabolism is 1,200 calories, you cannot eat more than 1,200 calories, otherwise you're putting on weight. So what are the solutions? Well, we get some blood work, we find out why your metabolism is slow. We may not always have those answers. The blood work come back completely normal, it's possible. But if your thyroid's off, we need to fix that. If your estrogen, progesterone, testosterone levels, or testosterone in men are off, we could actually fix those things and get them back to normal. It's called bioidentical hormone replacement therapy. And you may be a candidate for that, and that might help you keep the weight off long term. Now, not everybody has those problems and they still have a slow metabolism, which means we don't know why your metabolism is slow, but there are ways to fix it. A bunch of studies have shown that even your gut health, the microbacterium that are in your intestines can actually affect your metabolism. So doing probiotics, changing your diet, making sure you're eating foods that are directed to your body specifically to actually help you with that. Next up, you're going to have to change your diet. You're going to have to change what you're eating, how you're eating, and your lifestyle. But we also have herbal supplements that are out there that can help speed up your metabolism using just herbals naturally. So long term, it all depends on what the blood work comes back, whether you have a hormonal issue or you don't have a hormonal issue. If you don't, then we do have some other options for you, which include the herbal supplements to speed up your metabolism, but also lifestyle changes like exercising regularly. But it is really important to seek out a medical provider who specializes in medical weight loss, has a comprehensive program, who can tell you what your basal metabolic rate is, and do some blood work to find out what's going on. Please remember, your weight may not be your fault. It could be a hormonal or metabolic problem, and you just need to find that out. So, go seek out a healthcare provider that can help you with that. As always, Dr. Michael Nusbaum here, happy to talk about anything you guys are interested in. Please DM us if you're interested in a topic specifically. We'll see if we can tackle that topic too. Hope to see you guys again soon.